most of the people have this doubt, brother. If you are working in hospital sector, what is the duty timings, and if there are any week off or any benefits like overpaid? So these are the most important doubts. Overall, people are asking these doubts because if you are working 1 month or 2 months, we need salary, right? If you are working in hospital or clinic or industry, we should know that before coming to Saudi Arabia. This is most important video for who all are coming to Saudi Arabia for nursing jobs. So in this video I will explain you that different duty timings for nurses on hospital, clinic or industry. So if you are watching this video for the first time, please do like, share and subscribe our channel. Let's start the video. First, I will tell you that duty timings in hospital settings. First, in these hospitals, mostly all departments are there, like emergency department, ICU, cath lab, OT, ER, and OR, OPD. So different departments have different duty timings. Like emergency department, and in Saudi, I am telling emergency department, ICU, and general ward. So these departments have 12 hours shift because after 12 hours shift they will get 1 day or 2 days week off, so they can manage in per week 48 hours like that. So in OR and OPD, this outpatient department mostly 8 hours duty. OT, cath lab, these department highly specialized departments have 8 hours duty times, 8 hours or 9 hours general shifts we call it. So that departments have 8 hours shifts. Mostly in weekly 48 hours you should work, like either 12 hour shift or 8 hour shift. Mostly you need 48 hours in a week. So no exchange shifts. If they in charge keep like 12 hour shift on Monday, you should go on Monday only. In India, we'll say, sister, I won't come tomorrow, please, I need week off, like that. No. Here, if you are sick, you have to inform before only, or you have to mention the in diary in one letter and inform to HR, I need leave tomorrow. Like that, before only you should inform. Next one, no exchange shifts. Second, 2 days duty and day off. If you are in hospital settings, like 1 day 12 hour shift, next day 12 hour shift, both 24 hours finished, right? Next day you will get 1 day or 2 days week off. Like that, they will exchange our duty hours. In general shift, like 6 days you should do 8 per day, 8 hours or 9 hours. Then every week of, like week in India will get every Friday or every Saturday, as your wish. After 6 or 7 days finish, you will get 1 day week off, right? So here also 6 days work, 1 day week off. Like that, it's depend upon hospital settings. So as per Saudi labor law, we should work here 48 hours in a week only, like 4 into 12, 48 hours. Either you will do general shift or 12-hour shift. So food and accommodation in hospital side, mostly hospitalization they will provide, employer provide that food allowance they will give, but you should prepare in the accommodation. Free accommodation they will provide, and free transportation, free insurance. So this is overall about hospital settings. So next one, clinics. Clinics is nothing but in Saudi, mostly some different clinics are there, like laser clinic, dental clinic, and ENT clinic, normal emergency clinic. So these are the overall different clinics. In that, mostly 8 hour shift are there or 9 hour shift. Mostly 8 hour shift they will allow. But in that, like say normal shift, general shift, per day 8 hours, do 8 hours you should work, then once week off, every Friday week off, like that. Because here in our India, Sunday holiday, but here in Saudi, every Friday holiday. So like that, mostly we'll get Friday week offs only. So 6 days you should work, 1 day week off, and free accommodation, free transportation, free insurance, and food also. They will give allowance. Some companies they will provide allowance, but some companies they won't provide. In that salary only we should manage for clinic side. So this is duty timings for clinic side. So next one, industrial side. This is most important. Most of the people are coming as an industrial nurse but they are not getting sufficient sites like me. So so that's why I'm telling, if you are coming to Saudi Arabia as an industrial nurse, select which good companies, what they will provide, like food accommodation, transportation, and insurance, and overtime allowance, and exercise gym. So most some companies they will provide gym also. So you should check all these things, which company is good, which company is bad, and which is manpower company, which is direct company. You should check these all things, then you should sign on the offer letter. So you should check all things. Next, 12 hours or to 10 hours shift. Mostly industrial side they will do 12 hours shift per day, because depend upon interviews they will ask questions, right? So as much as possible you should attend there, only they will select you. And salary also depend upon that, they will give you salary, it depend upon your skills and everything. So mostly industrial side 12 hour shift are there, and some companies and they will provide food also, free food, and free accommodation, good accommodation, and transportation also. So this is industrial side. But when you are planning to come Saudi Arabia, you should check all things, overtime allowance are there or not, they will give time to time salary or not. So all things you should check. If you are doing at hospital and clinic or industrial, first check whether they will give overtime allowance or not. That is mandatory, right? If you are working at like extra hours also, if you are getting money, then good. Otherwise, all people come to Saudi Arabia or any other countries to earn money, to financially stable. But if they are getting salary time to time, then it's okay. But if you are not getting salary properly, that is waste of your time, right? So like for me, so that's why I'm saying, if you are have any doubts, please put it in comment, I will give you a reply. And I hope you understood this video. If you like this video, please share to your friends, and please do like, share, and subscribe our channel. We'll meet in another important video. Until then, keep watching my videos. Bye bye.